Beyond the pharmacy. The rise of herbal medicine. Imagine your doctor gives you a prescription and says you'll be on it for life. A year in, you feel trapped, wondering, is this really the only way? For Elena, a 58-year-old grandmother, that feeling was a constant hum of anxiety. Her blood pressure numbers were still stubbornly high, even with her medication. For David, a 45-year-old contractor, it was the sharp, daily pain of arthritis that his pills only seemed to numb, but never truly soothe. They were following the doctor's orders, but they didn't feel like they were getting better. They were just managing, not healing. Before we dive in, please subscribe to the channel. Modern medicine is an absolute miracle for saving lives in a crisis, but for long-term chronic conditions, the experience can sometimes feel different. The focus can shift to managing symptoms. High blood pressure? Here's a pill to bring the numbers down. Joint pain? Here's another to quiet the inflammation. For patients like Elena and David, this can become a frustrating loop. The medications can come with their own list of side effects, dizziness, fatigue, and stomach issues that almost feel like a whole new problem. There's this feeling of losing control, of depending on a daily pill that just doesn't feel like it's making you well. That frustration can go even deeper when the cultural traditions you grew up with are brushed aside as old folk tales. Elena remembers her grandmother brewing special teas, and David's family used herbal compresses for aches and pains. But in a sterile clinic, that kind of wisdom often disappears. The breaking point for them wasn't some big dramatic event. It was a slow dawning realization that there had to be something more. This wasn't about rejecting science or throwing their pills in the trash. It was about finding a more complete approach to healing, one that treated the body as a whole. Their search led them back to their roots and into the world of herbal medicine. Elena started reading about hawthorn, a plant with a long history of use for heart health in both European and Chinese traditions. She was skeptical, but she was also hopeful. David began looking into turmeric and its active compound, curcumin, known for its anti-inflammatory reputation. For both of them, this wasn't just about swapping a pill for a plant. It was about taking back a little control over their bodies. It felt intuitive, empowering, and deeply personal. As Elena worked hawthorn berry tea into her daily routine, alongside changes to her diet and exercise, she started to feel a shift. It wasn't a miracle cure, but she felt more vibrant and less anxious, and her blood pressure readings felt more stable. This isn't just folklore. Hawthorn has been studied for its potential to support cardiovascular health, though researchers agree more high-quality studies are needed to confirm how effective it is for managing blood pressure. David started adding turmeric to his food and taking it as a supplement. He noticed that the morning stiffness in his hands seemed to ease up, and he could grip his tools with a bit less pain. Science is looking at this issue too. Some smaller studies have suggested that curcumin may help reduce the pain and inflammation of arthritis for some people. It's not a proven replacement for standard treatment and isn't free of side effects, but it's a compelling example of how nature has always been a source of healing. In fact, scientists derive or find inspiration for a significant number of modern drugs from compounds first found in nature. The stories of Elena and David aren't about finding a magic cure. They're about a change in perspective. They show that healing isn't just about silencing symptoms, but about listening to our bodies and finding care that feels complete and respectful. Their journeys beyond the pharmacy are about a deep need to feel like an active partner in our health. By looking to both the past and the present, they started to build a healthier future, one that put them back in control of their own wellness. Disclaimer: this video is an informational video, and before you start any herbal remedy, consult your physician. If you like this video, subscribe to the channel and share it with others.